A North Carolina lab is finding a new variant of the coronavirus in more than a dozen test samples. Mutations in the virus are believed to make it easier to spread. The CDC still not saying for sure if current COVID-19 vaccines are effective against it. CBS 17 digital reporter Judith Ratana getting answers about what a new variant means for you and how concerned we should be.
Mako Lab says they've spotted a new variant of COVID-19 in 13 samples. So far, the CDC reports just over 100 cases, none of those in North Carolina.
I would assume it's already here.
Dr. Dirk Dittmer's lab analyzes samples to look for new variants. He says tracking mutations in the virus helps scientists track spread and ensure current testing works.
In addition to just counting how many people are infected, we now know which people are infected with which virus. And that helps us, for instance, identify if a lot of people got infected at the same place.
The kind of work that finds new variants only happens at a small number of labs or universities like UNC and Duke. It's why we can't be certain exactly how many people have a mutated version of the virus. If a variant turns for the worse, scientists can quickly readjust vaccines to ensure they stay effective.
I want to make sure we respond to it, but I'm not worried.
And you shouldn't be either.
Does it not impact your disease or how you're treated? It helps us predict the future at this point.
Scientists are still trying to figure out why it seems new variants are sometimes more transmissible. In the meantime, double down on masking and social distancing to deter increasing case numbers.
If that new variant comes and becomes more transmissible, it will prolong the peak.
I have a map showing what states have the highest number of cases linked to this new variant and how close that is to North Carolina, along with where you can go to get tested for COVID-19 in my story at CBS17.com. I'm digital reporter Judith Ratana, CBS 17 News.